Assalamu alaikum students. So today we will discuss the questions regarding the face in the head and neck block. So first of all, the question is draw and label venous drainage of the face. So this is a very important question. So it can be in the form of a draw and label, or it can be in the form of the description, that is describe the give the venous drainage of the face. Another important question from the venous drainage of the face is a scenario based question, that is, a 28-year-old male presents to the emergency department with complaints of severe headache, swelling around the eyes, and fever for the past 3 days. On examination, he has periorbital edema, proptosis of right eye, decreased eye movements. So his vital signs indicate that he has a fever of 39 degrees centigrade. He mentions that a few days prior he had a painful pimple on the upper lip, which he attempted to squeeze. Now, blood investigations reveal elevated white blood cell count, and imaging confirms cavernous sinus thrombosis. So now this question can be asked in the form of a scenario, and the diagnosis can be given, that is of the cavernous sinus thrombosis, but often the examiner used to ask, they don't give the diagnosis, rather they ask what is the diagnosis and what is the dangerous area of the face and why it is clinically significant, and explain how infection from this area can lead to cavernous sinus thrombosis. So next is the question regarding the parotid gland. So what is parotid fascia? What is parotid fascia and what structures are present within this gland? So you have to tell about the structures present in the substance of the gland. Okay. Another question regarding the parotid gland is the a 45-year-old male presents to clinic complaining of sweating and redness over the area in front of his right ear whenever he eats spicy food. He had undergone surgery for a parotid gland tumor a year ago. On examination, the affected area becomes flushed and moist during stimulation of salivary secretion. Name the condition. Now they have asked about the condition and how it is related to the patient's symptom. How come the surgery of the parotid gland tumor is causing the flushing and moistening of the area of the face during stimulation of the salivary secretion? And describe the parasympathetic, secretomotor, and sensory fibers, sensory nerve supplied to the parotid gland. So again, this is a favorite question of the examiner, that you have to describe the parasympathetic secretomotor supply to of the parotid gland. Next question regarding the face is the briefly describe the cutaneous innervation of the face with the help of a labeled diagram. So students, be careful. You often write whenever it is asked about the cutaneous innervation of the face, you often write about the facial nerve. So facial nerve has no cutaneous supply on the face. Rather, it has got it supplies the muscles of the facial expression. The cutaneous innervation of the face is supplied by the three branches of the trigeminal nerve. So you have to briefly describe as well as the make a diagram to explain the cutaneous innervation of the face. Now, what are the different nuclei associated with facial nerve, and give course and branches of this nerve? Name the foramina from which it emerges out of the skull, and what is Bell's palsy? Give its clinical manifestation. So, a question regarding the nuclei associated with the facial nerve. So, you have to tell about the nuclei which are present in the pons and medulla, pons area. Okay, so the motor nucleus of the facial nerve, the salivatory nucleus, the lacrimatory nucleus, So these are the nuclei. And the course and branches of this nerve. So you have to tell about the course. The intracranial, you can divide it into two parts, the intracranial course and the extracranial course. And same with that, the branches, that is the intracranial branches and the extracranial branches. So the question can be asked in any form. Give the extracranial course and branches of the facial nerve, give the intracranial course and branches of the facial nerve, and then the foramina from which it emerges out of the skull. So it emerges out of the skull from the stylomastoid foramen. Now, the condition, what is Bell's palsy, and give its clinical manifestation. So, Bell's palsy is the lower motor neuron paralysis of the facial nerve, and the muscles supplied by the facial nerve, they are paralyzed in this condition. Now, another question, give the course and branches of facial artery and why it is known as an anesthetist artery. So often answering this question, the students often reply with different answers, and some they are very funny. Why it is called an anesthetist artery? Because anesthetists usually take pulse from the face where it passes from the base of the mandible, where it enters the face from the base of the mandible along the anterior border of the masseter. So the anesthetist, they feel this artery here and they can take pulse. They can count the pulse. So that's why easily, they can count the pulse easily from here. So that's why it is known as anesthetist artery.